Hello and welcome to Inside EMA, a podcast about the science behind medicines regulation and the people who make it possible. My name is Alessandro Faia, I'm a communications officer at EMA, and today we will talk about antimicrobial resistance with the help of Steffen Thirstrup, the Chief Medical Officer of the European Medicines Agency. Welcome, Steffen.
Many thanks for having me.
Thank you for joining for this first podcast, hopefully the first in a long series. We want to bring you behind the scenes of the European Medicines Agency here in Amsterdam. We will discuss topics about science and medicines, and we will give you an opportunity to meet our experts, so the people who work in this building for the benefit of public health in the EU. Today we will discuss antimicrobial resistance. It's a topic that has gained a lot of traction in the media recently, and it is one of the most worrying public health threats. Steffen, I want to start by asking you to give us a little bit of a refresher. So, what is antimicrobial resistance?
So, first of all, many thanks for having me here today, Ale. And I think it's an important topic to discuss antimicrobial resistance. Antimicrobial resistance is the situation where antimicrobials, so penicillin and other antimicrobials, don't work any longer, simply because the bacteria have evaded the effect of these products. And that's, you could say, a natural part of being a bacteria. You want to evade what is trying to kill you. So that's an inborn part of being a bacteria. Some bacteria are better, if we can call it that, than others to develop resistance. And some antibiotics are also better at creating antimicrobial resistance. And to put it into perspective, it means that the antibiotics that you would expect to cure your infection suddenly doesn't work any longer. And then you could argue, well, then my doctor is just going to prescribe me something else. But the problem is, and at the state where we are at the moment, is that for certain infections, there are no alternatives. And that means that you can suffer from an infection for which there is no curative treatment. Well, then you could say, well, if it's just a sore throat or something, I could live with it. But we are talking about some serious, and some of them even life-threatening diseases, infectious diseases, where there is no or only very, very few antibiotics available.
So the statistics from the WHO, the World Health Organization, tell us that 1 in 6 bacterial infections are due to bacteria that have become resistant to antibiotics. So it is a massive problem, and it is especially because antibiotics are the cornerstone of modern medicine in many ways. Because, for example, even people who need to undergo treatment for cancer, or if you need an operation, so you need antibiotics. On a personal level and on a professional level, of course, how concerned are you?
I'm very concerned because we've seen the growth of antimicrobial resistance increasing and increasing. And even though industry, the pharma industry and academia is doing a lot to invent new antibiotics, that rate of invention is not keeping up with the pace of antimicrobial resistance. So it is really concerning, and thinking about it, it's roughly 100 years ago when Alexander Fleming discovered one of the first antibiotics, penicillin. And the pre-penicillin, the pre-Alexander Fleming area was actually an area where people died of even very simple infections. And there is a risk that we, in a few years and maybe in a generation's time, will be back to pre-penicillin area where we cannot treat simple infections.
Touching on your Alexander Fleming reference, while I was researching a little bit for this episode, I came across the lecture that he gave when he was awarded the Nobel Prize together with other collaborators for discovering penicillin. And it was actually the last few pages, I think, are dedicated to, it was almost sounding off an alarm, like we need to be careful, because if you underdose yourself with penicillin, he was saying, then you're making the bacteria more resistant, and then the treatment is not effective. So Is it a man-made phenomenon? Is it an exacerbation of the natural ability of bacteria to evade treatment?
It's to large an extent an exaggeration of the ability of bacteria to develop resistance, but you can harm yourself by not taking your antibiotics in the right way. So I think many of us learned that when you get antibiotics prescribed for, let's say, a week, but you will feel well after a few days and then you stop your treatment. But that actually means that there may be a few bacteria left in your body, and those that are left in your body are those that could survive the initial part of the treatment. That means they are more prone to develop resistance. So taking the cure to its end is important. Dosing in the right, so the right concentration reaches and can kill the bacteria or inhibit their growth. These are important things. But it's also a man-made problem in the sense that the consumption of antibiotics is not only done by humans who are suffering from whatever diseases. We are also using antibiotics in our livestock farming. And some of those antibiotics end up in the food chain. A lot of the antibiotics, including those you and I may be taking, ends in sewage water and end in the environment. So it also means that the bacteria, not only when they infect you, but also when they are circulating in the surroundings, are exposed to antibiotics that can make them resistant.
And Steffen, we are an EU organization, and our main job is to make sure that medicines are safe, effective, and of high quality, and we work both in the human and the veterinary domains. So there is this concept that we use a lot, which is One Health. So it means that basically the health of people is not disjointed from the health of animals. And there's a lot that we've been doing in recent years to, for example, to track sales of antibiotics and the use in the veterinary sector. Maybe if you want to just...
But that's important because tracking the use is at least a proxy for how big the burden or the pressure on the microorganisms are. And today our colleagues at the European Centre for Disease Control have released statistics on the current consumption of antibiotics. And this in humans, I gotta say, we leave out. We are also doing statistics on animals, but I think that's for another discussion, another day, and a discussion another day. But those statistics, despite all the efforts we've been doing over the past couple of years in sending messages around being restrictive in the use of antibiotics, there is still an increased use of antibiotics. And it's even more concerning that a large part of that increase is still among the type of antibiotics that are more prone than others to create resistance. There's an international agreed way of classifying antibiotics, fundamentally in 3 groups. The ones that you always should consider using. Then there are some that you could be using as an alternative or for certain infections. And then there is a group, the last one and the most important one, I would say, are those that you reserve to the very, very rare cases of severe infections with resistant bacteria. That means these antibiotics may work or will often work, but they're also very prone to create further resistance. So they are aimed for the rare cases. And across the board, we still see an increased use of all 3 kinds of products.
And you alluded to it, today is European Antibiotic Awareness Day, which is marked every year. And this year, the theme is dedicated to healthcare professionals. As a fellow healthcare professional, have you ever encountered a case when you were a practicing physician? Have you ever encountered a case of antimicrobial resistance, and how did that look like?
Yes, I have encountered it, and I think in many cases it's the patient that comes back to you and say, well, I still have symptoms, I don't feel well. And whether it's due to resistance or whether it's due to the patient not taking the antibiotics in the right way can be difficult to judge. And then you sometimes switch to another product in the hope that it works. But I also seen patients with overgrowth of resistant bacteria in their intestines that can be very devastating and giving, colitis, so bleeding from your intestines, and can be very life-threatening and difficult to treat. So I've seen that, yes.
And indeed, we know that there are estimates that are compiled every year, and currently we estimate that 35,000 people in Europe die every year due to infections that are resistant to antibiotics. How concerned are you, Steffen?
I'm concerned that it's only the tip of the iceberg, and I think 35,000 is it's the best number we can get where we are completely certain that these individuals died due to resistant bacteria. There will definitely be a gray zone of people who were suffering from other conditions, maybe severe heart disease, maybe cancer, where an infection that couldn't be cleared due to antimicrobial resistance was contributing to their premature death. It cannot be, but 35,000 for sure.
We talked about the causes, we talked about the state of things, but we can try to talk a little bit also about what could be the solution. So we talked about responsible use, limiting overprescribing, but we also know that one of the resources that we're missing at the moment is new antibiotics that come to the market. So there was another interesting statistics released recently by WHO. It was about the pipeline of antibiotics. So the antibiotics that are currently being developed and at the first stages of trials in humans. And the pipeline is, let's say, that has seen a decrease in the last 2 or 3 years. And another characteristics that they highlighted is that the companies that are developing these antibiotics are mostly very small companies, probably startups or academic spin-offs. So what can EMA do? Because people know us mostly because we do evaluate, we do the scientific evaluation of medicines and we monitor them. But then there are also things that we can do to make sure that these products come to the market faster.
Yeah, completely right. And there are actually, as you alluded to, 2 problems here, or 2 challenges, not necessarily problems. The problem is the decreasing pipeline, so the likelihood that we will have more antibiotics to prescribe and to deal with antimicrobial resistance. And the other one is that many of developers here, as you said, they are academic, small, medium-sized companies, which in itself is not a problem because they may do good science for sure. But the challenge for many of these developers are that they don't know the regulatory system. They may be doing really, really good academic science that can end up in high-impact journals, but they may not be tuned in on what would be the requirement for regulatory authorities like EMA to bring that product from the lab to the bench, to the bedside, and manufacturing and sell it and so forth. So therefore, we offer a lot of possibilities for developers to engage with us and get advice on what kind of studies do you need, and definitely also what kind of studies do you not need to spend money on. And I think money, coming back to because it's also about money here, because they need money to bring the product out of the lab into doing clinical trials, so testing the medicines in humans. That's the most expensive part of making a new medicine, is that you bring it into clinical trials. So they need someone to put money into that. So they need someone who believes in their product, and that belief could, of course, be supported by having a positive agreement and a development plan supported by an agency like ours. The other issue related to money is the pipeline that is decreasing. Because as I explained before, we put antibiotics into 3 different categories. And if you're developing a product that is especially targeting resistant bacteria, it will end up in the group of restricted antibiotics, being in the group of restricted antibiotic also means that your sales will be low. And there you can already hear what I'm alluding to. You need to spend a lot of money to develop your product, where you in the end will have a product that will be put on the shelf for the very few occasions.
You have no return on investment.
So the return of investment, or the likelihood that you in the foreseeable future will have a return of investment, is low. So we have a broken business model for developing antibiotics. And that's outside the remit of the European Medicines Agency. But this is, of course, something that is high on the political agenda, trying to create incentives and coming up with different kind of legislative proposals that could somehow stimulate the development of antibiotics and fix the broken business model and bring antibiotics forward.
So this is definitely maybe a societal solution, societal problem that
it's definitely not a solution that we can solve as a regulatory agency on its own. We can, of course, help the developers and set directions for what is needed in terms of developing, but finding the money to doing so and finding a financing model for developing products that will be restricted in their use is outside the remit of EMA.
Our colleagues at the ECDC, the European Center for Disease Control and Prevention, they have released data in November that tells us that Europe is not reaching its targets to limit the spread of antimicrobial resistance. What is your take on this new data?
Thank you, Ale. It's really concerning. I believe we have spent several years on explaining the importance of prudent use of antibiotics, selecting the most appropriate antibiotics, explaining the importance of taking the full course of treatment. Despite that, we see the most recent data released in this month from ECDC that there is still an increased use of antibiotics, and it's measured per capita, so there's taking into account that the change of the population may be there. So there's increased use of antibiotics, and it's across the board. So it's not only the recommended antibiotics, but what is more concerning is also the group of antibiotics that we reserve for the most severe infections and for the multi-resistant bacteria. So we still see an increase despite our efforts here.
Another part of the solutions, maybe something that people don't necessarily associate with this problem, might be vaccines. Because by using vaccines to prevent certain diseases, we could actually limit the use of antibiotics.
That's an excellent point to bring up. And I think many of the audience might be thinking, when we mention vaccines, I think the COVID-19 vaccine will be the first one that pops to their mind. But every child in Europe is hopefully getting vaccinated against a lot of childhood diseases. Some of them are viral diseases, and maybe we also here going to make one thing clear again. Antibiotics only works against bacterial infections. So there are a lot of diseases that are viral in its course. Antibiotic doesn't work, and that comes also back to the talk about prudent use. There are infections where antibiotics should never be prescribed because the disease is caused by a virus. But coming back to the vaccines, there are a lot of vaccines already in the childhood vaccination program that protects against bacterial infections and also severe bacterial infections. And that's, of course, also a way of trying to solve the problem around antimicrobial resistance, stimulating development of vaccines against frequent infections, or serious, not necessarily frequent, but serious infection. That could be meningitis as an example. It could be severe pneumonia caused by pneumococcal infection and so forth. So there are numerous cases where we could think about developing effective vaccines as an alternative to waiting for patients to get infection and then treat them with antibiotics.
You said the word alternative. And is there any alternative treatment that can be used that is, well, we talked about vaccines, but Are there any alternatives being considered?
For humans, I don't think there are many at the moment alternative. There is interest in what is called phage therapies, and phages are, now becomes a little bit technical, sorry, but phages are viruses that attack bacteria. So you're actually trying to kill the bacteria by infecting them, in a little bit in inverted commas, with a certain type of virus. We've seen a lot of interest in this in the veterinary space with phage therapies, and also in the veterinary space because we talked early on that some of the burden of antibiotics in the environment, some of that burden comes from use in livestock farming. And there's also initiatives going into looking whether you can find alternatives to treat certain diseases among livestock. Instead of giving them antibiotics, you could have alternatives.
Steffen, I think I'm about to wrap us up. But before we go, I would like to ask you if you have any recommendations on things to watch, things to read that can be related to the topic that we discussed today, but also, recommendations from one science enthusiast to another.
Well, if we are to stay in the area of infectious diseases, I spent some time in my summer holiday reading the autobiography by Anthony Fauci. And maybe not everybody remember who Anthony Fauci is, but he was working for the US National Institute of Health. He worked there for 40 years, so he have a legacy going way, way back until before the HIV pandemic. And he was finally involved also in developing vaccines to COVID-19. I know it has not necessarily something to do with antimicrobial resistance, but if you want to read a biography of a person who has spent his entire professional life fighting against different kind of very, very severe infections, be it viral or be it bacteria, I think Anthony Fauci's book, it's called On Call.
Okay, Steffen, we are running out of time, so I will have to wrap us up. But I want to thank you for your time, for your knowledge, and I think we're going to see you again around these parts.
It's been a pleasure being here. Thank you, Ale.
So I want to thank our listeners for tuning in. I hope you really enjoyed the episode. If you did, please share it with a friend, give us a like, subscribe, and check our social media channels where we'll be posting a little bit of behind the scenes, backstage, and we will also be probably talking about the next topic. So we will be back with a new episode very soon. Thank you again for your time, and we'll see you next time.